Good morning, everybody. Welcome to today's 1 Million by 1 Million Strategy Roundtable for Entrepreneurs. 1M by 1M, as you know, is the first and only global virtual accelerator for technology startups. Our mission is to help 1 million entrepreneurs reach $1 million and beyond in annual revenue. In support of that mission, we do these free roundtables week after week after week, and we've been doing them since 2008. So it's been a very long time. This is a 598th session, and every single roundtable recording is available on our YouTube channel. This event is also being recorded, and you will have a chance to pick it up on the YouTube channel when it's published. You can also follow us on Twitter. We publish a lot at 1Mby1M and at Stromana, the two handles. These are the call-in instructions. We will take Q&A. First, though, we do have scheduled programming. So I will put the slide back up a little bit later when we are ready for Q&A. Today, we have two entrepreneur pitches. I want to set some expectations, whether you're pitching today or at a later session. We are on your side. This is a safe working session. And all we're trying to do here is brainstorm on your strategy and find ways of accelerating your journey. There is no other agenda. If you disagree with my feedback, that's okay. It is your prerogative. It's your venture. It is your prerogative to do whatever the hell you want to do with your venture. My goal is to give you candid feedback so that you can do something meaningful with it. I'm not going to give you a gratuitous pat on the back. I will give you a pat on the back. If you're doing something good, I will give you a pat on the back. But that's not the intent of this. The intent is more to, have an honest, intellectually honest conversation about your strategy. So please take it in that spirit. We are going to start the session today with Black Med Connect. Jasmine Weiss is the presenter, the entrepreneur. Jasmine, please unmute your line and tell us what you're working on.
Perfect. Thank you so much for the opportunity. My name is Dr. Jasmine Weiss. I'm delighted to be with you this morning to share with you about Black Med Connect, or BMed, which is an exclusive social network and professional network for Black physicians and medical trainees. Next slide, please. So just a little bit about myself. So I have a passion for mentorship and thinking about ways to promote equitable access to care for historically underrepresented groups. And that also, in that vein, also want to contribute to how do we think about upward economic mobility for Black and Brown communities. And so in that vein, I'm not only a pediatrician, I'm also a researcher. So I work at the School of Medicine at UNC Chapel Hill. And a lot of my interests stem from my personal background. So I went to a historically Black college by the name of Florida A&M University. I went to Duke University for med school. And then I did my pediatric training in Atlanta, Georgia at Emory, and did my research time as a fellow in the National Clinician Scholar Program at Yale. So I've taken all of that together, and I realized that entrepreneurship is a path forward, and thinking of a way to create an inclusive environment is something that I'm very passionate about in a lot of different ways. So my asks or my questions are thoughts on the pricing structure of my business. I'd like you to kind of help me brainstorm that, as well as my go-to-market strategy and how to think about different funding opportunities. So next slide, please. So our mission at BMed is to create an exclusive social network for Black physicians and medical trainees that fosters community and professional development. So when you think about this platform, you can think of this as the LinkedIn for Black physicians and physicians in training. Or if you're familiar with Doximity, which is a platform for all physicians that recently IPO'd, it could also be approached as a platform similar to Doximity, but for Black physicians and physicians in training. Next slide, please. So I'd like for you to meet Jennifer. She is an aspiring physician, and she is a medical student at an institution where she's one of only 4 in her class. Out of 200 people, there are 4 African Americans and 2 different campuses. So ultimately, she's only one of 2 on the campus that she is in school in. And so she this is a real person. This is a person I've spoken with, and I've spoken with many people who feel isolated. They feel like they have a lack of meaningful professional and social connections, and that translates into a lack of guidance and mentorship when thinking about next steps and career choices. Not only is it a difficult situation when you think about career navigation, but then when things happen, such as microaggressions or things where patients aren't treated particularly well, there's this feeling of an uneasiness about using the institutionalized platforms that are available to share their concerns. Next slide, please. So that's one aspect of this problem. The other aspect is that institutions are having trouble to connect with Black trainees and Black and Brown trainees. And there's a difficulty in recruiting when that pool is so small. When you start to spread out from medical school to residency and to fellowship, there's just not enough diverse individuals to go around when thinking about how to fill these spots. So there's challenges in meeting the accreditation standards for these institutions, as well as the jobs that are out there. Next slide, please. So my solution is Black Med Connect, which is an exclusive first social platform for Black aspiring physicians and practicing physicians. This will be a safe space that's culturally sensitive, which eliminates that feeling of isolation by bridging that gap, both with virtual and live opportunities. Not only for social connections, but also for professional connections where trainees, institutions, and employers eventually will be able to build upon career navigation and professional development, and then ultimately ending with some employment opportunities for trainees as they progress. Next slide, please. So this is going to be a mobile app. Next slide. So the first phase of this rollout of the of Black Med Connect is we'll start with trainees and attendings. So medical students, residents, fellows, and attendings. And this will be a safe place, a secure place, and it'll function similar to a social platform in its most basic MVP stage. But with phase two, we'll start to roll out the professional development opportunities, more virtual events, as well as live events as we build up an audience from the platform. And there will be opportunities for mini courses and master classes, things of that nature when it comes to career guidance, as well as mentor-mentee connections. Step three would be to have employers such as hospitals, practices, medical recruitment firms subscribe as a marketing solution and a marketing tool to BMed, so that as trainees finish training, whether they're at the residency stage or if they choose to subspecialize, then on the BMed app, they'll be able to be paired with jobs. So this would be effective for academic centers, training programs, hospitals, and all of the ancillary services that go along with that. So in training, students move from place to place a lot. So the financial support services, mental health, relocation services, all of those things are integral to making it through this pathway. They'll also be able to use BMed as a marketing tool. The reason we chose to think of it this way, sorry, just to kind of highlight, the student phase is a low market penetration phase. It doesn't take a lot of a sales force to be able to connect on that level. But as you move up, thinking about what the needs are to make this effective, you need a more extensive sales force, and it's much harder to penetrate the market when thinking about a marketing solution to a hospital. So that's why we've kind of chosen this stepwise approach. Next slide, please. So in terms of a business model, we've thought about this a lot and very open to thoughts here. We think it should be a paid subscription model for each phase, but it would be a tiered subscription model. So your trainees would pay a smaller fee than your individuals who are already certified, board certified attendings. And then obviously the most of the finances coming from the marketing solution for the academic centers and employers. Next slide, please. And so just to give you more details here, Approximately, there are about 9,000 African American medical students. And if we were to charge roughly about $10 a month for their annual subscription, and then that would be tiered with residents having about 6,000 African American residents, that being about $15 a month, and then attendings paying about $20 a month. The total addressable market here is about $13 million if you think about the trainees and practicing physicians. Next slide, please. Now, when you think about the B2B or with the hospitals and employers, it's a little bit of a breakdown that takes place here. So there are roughly 192 medical schools, and each of those schools have medical students, and then they have a group of residency programs, and then some have fellowship programs. And so when we think about our pricing model for schools and institutions, we really thought about what do schools typically pay if I'm going to a conference to recruit students. So medical schools roughly pay about $5,000 to $7,000 for a recruitment table at a conference for 3 to 5 days. So when we thought about our price points for medical school, that would be about $5,000. When we think about graduate medical education, that includes residency programs and fellowships. So that rate would be about $10,000 annually. When we think about hospitals, there are about 6,000 hospitals in the United States, over 200,000 practices, and they spend a lot of money on recruitment. And so looking at some past data from LinkedIn and how they started and Doximity, we feel that a $5,000 to $10,000 price range as a subscription will be within reason of what they're typically paying for recruitment tools at this time. They pay much more as well, but we're thinking we can start here. And that total addressable market is about $1.63 billion. Next slide, please. So what makes us different? So there are a lot of forums out there that answer questions, and obviously that's a very integral part is answering questions. So Reddit, Student Doctor Network, and then Doximity. Doximity does bring that social piece in where all physicians can communicate with one another. And they definitely have future employment opportunities as well as a major part of their revenue model. But what we would be able to offer is a unique niche where we're focused on a group of individuals who are often very marginalized and need that safe space. Next slide, please. And so within this go-to-market strategy, we're starting, as I said, with the trainees and attendings and then employers. But I wanted to at least bring awareness to the fact that over time, if this model can work for Black physicians, then there's a lot of need for dentists, pharmacists, PAs, and even in talking to some of these individuals in different professions, they've asked, can we start now for our profession? But trying to create a model that works at one level before extending it out is the plan. And so we hope to do this outreach by attending major professional meetings, professional organization publications, social media marketing, and then next slide, please. And then content marketing. So we're starting the Black Med Connect podcast. We're hoping to launch here in about a month or so. My first recording was yesterday with some guests. So we're in that phase now. And then we're hopeful that word of mouth will play a huge role here. And then having referral discounts, et cetera, and hopefully moving to some institutional speaking engagements, specifically thinking about institutions such as the historically Black medical schools. There are 3 of those schools in the United States: Meharry, Charles Drew, and Howard. Those would be great places where you have majority African American medical students, residents, and attending. So hoping to start at those types of institutions and then moving more broadly to all institutions. Next slide, please. So we're right in the middle. We've been in our customer discovery phase in the winter or September to December. We're in the development phase of the app now with the prototype. We hope to start beta testing February, March, and launching the podcast. We're kind of gearing up for that now with hopes of reaching out to students and residents by May and moving on to some of the attendings and higher levels in July.
Jasmine, what is in the MVP?
So as of now, the MVP will consist of what most social media platforms have as the basic components, and then the opportunity for students to post.
Most social media platforms have a lot. So
Okay, I
you
could break it
cannot
down.
provide the level of functionality of Facebook or LinkedIn has in your MVP. It's impossible. So what specifically are you providing, and whom are you're trying to get Black students, medical students?
Yes.
And what is the draw? Why would they come?
So what we will have for sure is a social feed. We'll have groups. They'll be able to create some of the groups that they already have, such as the Student National Medical Association. They all use a lot of different tools. So we'll be able to unify where they can all, whatever chapter, whatever school they're at, they'll all be able to use this platform. We'll have anonymous posting. We'll have the ability to create events, even within smaller groups. That's all going to be in the MVP.
And what is your assumption that these people are already on Facebook or LinkedIn and are already active in social media, and they're going to randomly come to your platform from other
No,
social media platforms?
I think the assumption would be that these students are already in a specific organization called the Student National Medical Association, and they all need a tool to unify those chapters. That's the assumption. We're not necessarily worried about whether they use social media or not. We plan to go the route of this student organization that I was a part of, I was a president of as a medical student, needing a tool across their chapters that they don't have already.
And have you talked to this organization? Are they willing to adopt your platform if you put it out there?
That's a great question. We haven't talked to nationally anyone yet. We've only been talking to student leaders so far,
And
and they're extremely excited about it.
how many such student leaders have you talked to?
So medical students, I've talked to about 6 or 7. Residents, I've talked to about 5 or 6. Attendings, I've talked to about 5 or 6.
No,
So,
but these are all organizations. These are student leaders or attending leaders.
so
They're just random professionals or random students.
So the students I've talked to, some of them are leaders in the Student National Medical Association. They're chapters, so they're chapter presidents, vice presidents. The residents are chief residents that I've spoken with about it. The attendings, I've talked to some chief diversity officers and some faculty members who are program directors.
Okay, um, how many student organizations are out there? Chapters, not the umbrella organization, but chapters who might be using your tool to develop their communities. How many out? What is the, if you were to reach everybody, how big is that community?
So that community, every medical school has a SNMA chapter. Now, whether it's an active chapter year after year is that varies. But so there are 192 MD granting medical schools. I haven't tried to reach out to the DO granting medical schools just yet.
Mm-hmm.
Um, they all come to a conference called AMEC, the American Medical Education Conference, every year. It would be ideal if I could roll it out by then, but I don't think we'll be ready. That conference is in April. That was my first initial push, but I don't think I'll be ready to do that.
So 192 schools, potentially you should be able to get some number of those to join your MVP process, the beta testing process. And we're going to
Yes.
have to approach these organizations individually and get their buy-in and recruit your beta users. Now, once you have that, once you have recruited a bunch of uh, organizations, how many students per organization do you expect to bring in?
It will depend. So let's say, for instance, the school with only 3 or 4 students, that's going to be much less than the school that has 20 students per class that are African American. So it's going to vary. The better way, I think, the approach of taking the institutions that exist. So, for instance, Meharry College of Medicine in Tennessee is an historically Black medical school. They have about 400 medical students. Howard has roughly 400. Morehouse has, I left off Morehouse, forgive me. Morehouse has about 3 something, and Charles Drew in California, they also have about 3 to 400. So if I can just target those schools first, they all have SNMA chapters. That would go a long way to helping build up the proof of concept.
And at what point in this continuum that you're presenting here do you start seeing monetization?
So that's a good question. I have debated, should I make this platform free so that students can just use it, and therefore I'll have a lot of students when I go to employers? Like, that is one approach. Or should I try to do the monthly subscription for even the students to have some buy-in so that they'll use the app and then approach the employer? So that's kind of where I'm stuck, actually.
So social media projects like this are
Hmm.
always a chicken and egg,
Hmm.
because people who fund projects like this expect that you will bootstrap your way, the entrepreneur will bootstrap his or her way to millions of users.
Hmm.
Now, how can you do that? It's not easy to do, right?
Right. Hmm.
It's extremely difficult to do. So, so that's why I'm kind of looking for a strategy of how. So here's what I'm going to ask you to do some homework on.
Hmm.
Number one is, what is going to be your bootstrapping strategy?
Hmm.
As it stands, it will be very hard to raise any significant amount of money. You
Hmm.
can raise a bit of friends and family potentially. Maybe there are some grants available for Black entrepreneurs. You can research that. So bits and pieces maybe, but to raise any kind of significant funding, you're going to have a bootstrapping strategy that gets you to metrics that make you fundable. At the moment, this is not a fundable project. So
Hmm.
if I were to work with you within the 1M1M program, I would work with you to figure that out, that bootstrapping strategy. What do you do once? How do you put one step before the other and arrive at a fundable situation? And what these questions on whether to make the student program paid or uh, free, at what point do you start monetizing? How much money do you need to fund that process? What metrics do you raise funds on the basis of? All of that needs to be figured out
Hmm.
in
That makes
granular
sense.
detail, like granular detail.
Hmm. Hmm.
So you clearly have a vision, and there are some comparables. There is the LinkedIn, there is the Doctors Network, etc., etc. There are, but LinkedIn was a very heavily funded company. And at the
Hmm.
beginning, Reid Hoffman, who started LinkedIn, was extremely wealthy. He was part of PayPal. So he was extremely wealthy, so he could fund it himself to get to a point where the VCs were interested. And he had a reputation, etc., etc. So you're not in that stage. You're a first-time entrepreneur.
Hmm. Hmm.
So we're going to have to do this with metrics, not with your reputation as an entrepreneur. And you do not have personal money to finance this.
Hmm. Hmm.
So we're going to need to have a bootstrapping strategy in place that allows you to build up to a fundability stage. That's my feedback. That's really what we need to work on.
Thank you. Thank you for that. I guess when thinking about the bootstrapping strategy, because I'm funding the MVP. So luckily that's my contribution. But my my question would be, when you think about where to start, is it in your opinion, do you start with a pricing model and see if people will, because I have a landing page and I'm almost ready to kind of release that, to test if people would be interested enough to pay. Is that the method you go, or would you say start free and get your users and then just see if you can, if they don't, if you don't have enough users by X pay?
In my experience, people do not join social networks and start paying for it without seeing what it's all about, what value they're getting, and so forth. So if you start putting a paywall right away, I don't think you will be able to attract users.
Okay. Okay.
So you'll have to build up to a certain level. But then the question is, if you go to, let's say, a Howard University Medical School and say, put all your students on this platform, what do they get?
Yes. So that's a great question. So first they'll get that community, but second they'll be able to, well, so for instance, we want to have BMed networking sessions across, the country. So we'll have, especially residents, right? Residents are in the hospital 60 to 80 hours a week. If I knew that there was at least a virtual session I could attend and meet other Black physicians across the country, I would join that, even if it's just for 30 minutes, right? So those type of ongoing networking opportunities, eventually coming to live opportunities, having, if let's say I'm an intern and I don't know the subspecialty I want to do, knowing I can look up on BMed and find an attending who's already a cardiologist and I'm trying to be a cardiologist, that's a connection point. So having research mentorship opportunities that are virtual
Right.
and social.
But when you just launch this platform, none of that exists. People come onto the platform and find absolutely nothing. They cannot connect with anybody. They cannot do anything. They cannot attend. So if you ask them to pay, they're not going to pay.
Gotcha. Okay.
Right. So you have to, that's the thing about social media. You have to kind of finance a certain period of network development before value starts getting created. The value is in the network and people
Right.
starting to do stuff within the network. So it's very difficult to get people to pay for something that has no value to offer yet.
Got it.
So
Okay.
that's the answer to your question, that you will, unfortunately, in social media projects, there is a certain amount of, there's a period that you will have to finance yourself or from friends and family. And there's almost no going around that.
Absolutely. Okay. Well, thank you so much for your feedback.
You're very welcome.
This is my podcast coming soon.
Okay. Good, very good.
That's all.
So
Yes.
I can let me talk to Kuldeep, and then I will spend more time later explaining how to use 1 million by 1 million. If you decide to do that, then you can listen to that.
Yes, that's all ancillary things.
All right, Kuldeep, you are up next. You're on mute, Kuldeep. You need to unmute your line.
I'm so sorry. I've been following you on LinkedIn, and I'm really for reading the Bootstrap uh, community like ours. And I'm thankful for you to give me an opportunity here to talk about the business I plan. So, ONWAYZ basically is a social media platform. All right. Now, consider a fact that 1/3 of your time you either at your place or you are at a workplace. However, 1/3 of your time you are on a way which is known or unknown, right? There are people to take care at your place, and there are people to take care at your office. However, when you are at a place where nobody is there, there has to be someone to take care, like a so OnWays basically is a social media platform. It revolves. We can move to the next slide. It revolves on three basic aspects: uh, people, location, and offline businesses. Now, uh, there are a lot of online companies promoting online sales. However, the share of offline industry is declining. Correct? Offline could be a retail outlet, could be a salon, could be a restaurant, but a lot of efforts are being put to revive the offline business, which currently is the largest shareholder. But my product will revolve around people, location, and offline businesses. Uh, there are many problem statements. It could be an unidentified accident on a road. It could be issues with a new location in terms of language. It could be, uh, uh, like-minded people. Like when you're on a long trip travel, you would like to meet people with your own interests and hobbies. So these are the challenges we face, uh, and these are the problem statements. We can move to the next slide, please.
The problem statements, I will move to the next slide, but I'll give you a feedback right this minute. The problem statements are extremely vague and not at all easy to understand, and they don't really make a lot of sense either. So keep going, but that's my first feedback on this slide.
All right. No, I repeat if you want to go to the next last slide.
Sure.
Sure. So the first problem statement could be, you are at a place, and for an example, you're on a highway and you're unidentified, and in case you meet with an accident, correct? There's nobody to identify your blood group or your whereabouts. However, on this app, all the users will have their identity. So it's a geotagged application where if you are there on this app, person who's next to you, who's seen you in an accident, can identify your contact details if you are okay to share in your app, or maybe your emergency contact number or your blood group. So see what happens in a lot of.
I think there's a tremendous pushback against on privacy grounds.
So of course,
And I think people will be very reluctant to send us to share this kind of information on a social network.
yeah. So see,
Buy it at all.
I agree with your point. However, the location and the privacy thing will be the first and the most important point in your application. It's not that it's always available, your information. It's only when you want to show it to the world. For an example, you're on a long trip highway.
That's my point. My point is very few people will be willing to show this on their app because privacy is a very, very big concern. And the kinds of information you're talking about, blood group, location, etc., I think people are going to be highly reluctant to share that. So I think that's a no-go completely.
No, but it's basically to save their own life. So
Doesn't matter. I don't think you can convince people to do this.
okay.
It's a
Okay.
what an accident happens rarely in a person's life, right? It's like a pandemic happens rarely in the history of the planet. So look at how badly the planet prepared for this pandemic. It's, are you familiar with the black swan concept?
Absolutely.
Right? A negative black swan happens rarely. That's why it's called a black swan. So the pandemic was a black swan and the planet was not prepared for it. That doesn't mean the planet didn't have data that this could happen. Bill Gates has been throwing up his arms and screaming at the top of his voice that there can be a pandemic. Nobody was listening until the pandemic happened in 2020. So the planet did not prepare, the countries were not prepared, there was no system, nothing. The same thing about accidents. Accidents don't happen on a regular basis in people's lives. It's a exact same analogy, and people are not going to prepare the way you want them to prepare. They're not going to do it because human nature doesn't operate like that.
No worries. This is one of the angles of this app. However,
forget 15 angles. Tell me one angle that is a killer use case for which people will use your social network.
Right. So as I said, the first most important killer is that nowadays people talk about paid social media. This is going to be the first time we're going to reward our consumers. Even the content creators and the content consumers will be rewarded on this platform. I'll tell you why. Since we are tying up with
what is the use case? What is the use case? What are you trying to build?
Right. So
what is the use case of this social media?
The use case will be it will be promoting the offline businesses, and in a way there'll be rewards given to people who consume social media. But like for example, you consume Facebook or LinkedIn
media platform because some offline business wants to promote their business to me. Why would I join such a social media? Social media use case needs to be of value to the social media users. So if you want a community develop and find traction, viral traction, you need to be able to attract people to come and use the social media platform. You need use case and killer app for those users. I'm going to point you to something. Look at my Facebook profile.
Correct.
And on my Facebook profile, I was traveling for the last 7 weeks. I just got back on Monday. I was in Europe and I did this travelogue, my European travelogue for the last 7 weeks on Facebook with photos. You'll find that as an album. It's a public album, Europe Winter 2022 to 2023. In there, at the top of that album, if you look at it on feed mode, the last post that I made on that album is on the way back, I asked people who have been following that travel, a lot of people were following that travel. I asked them what they thought of it and what they're as an exercise to research the future of social media. And a very interesting discussion has come together in that thread. Go read
Wow.
that. Go read that, and you're welcome to dialogue in that thread. There's very interesting research coming together over there. So
Amazing.
my point is that you're going to need to find a killer use case of why somebody
Correct.
will join this social media platform.
Correct.
Okay. And nothing you have said so far convinces me that you have identified that killer use case. That's the problem with what you're presenting here. So look at
Correct.
this. We are stuck on the first slide. This is your first slide.
Right.
We already figured out where the problem is. So
Right.
the first order of business, everything else kind of is going to follow from there. It is none of this makes sense yet until you figure out what is the killer use case.
Okay.
Okay.
Fine.
So in the case of, in the example that I was giving you of what I did, I created this travelogue mainly for my close social network, my friends, family, some professional friends to look at it. But it
Right.
also happens to be that I have a large following. You know, a lot of people follow my work. So a lot of people were following my travelogue because they're curious about what I have to say, what I do, etc., etc. So there is that audience that is paying attention to this, but it's not necessarily what I've posted. It's not necessarily, you know, I'm posting photos of kids in my family, my, you know, etc., etc. It's not really relevant for them. And my assumption is that Facebook's algorithm is determining whom to show it to on the basis of the content and how much attention they're paying to this. So
Correct.
if it's not relevant, my assumption is Facebook will not be showing it to people. But I think the flaw in that assumption is that there is an outer circle of people who are paying attention because of the way Facebook is set up. You know, Facebook allows you to have 5,000 friends, an infinite number of followers. So even though my use case on Facebook for this particular travelogue is my close circle, there are a lot of outer circle people who are actually looking at it. And Facebook is showing it to them because they're looking at it, they're interested in it.
Correct.
So this creates a bit of a dilemma on what is Facebook's intent. What does Facebook want? What is the behavior that Facebook desires? Because you know, Facebook is also a place where a lot of people rant and rave and put all kinds of negative things, all the ultra right wing, ultra left wing, political stuff, QAnon, blah blah blah. I mean, there's like all kinds of crap there. So
Correct.
now, if you're a savvy user of Facebook, you don't see any of it. I don't see any of it because anytime anything negative shows up on my feed, I will hide it, and that hides gives feedback to the Facebook algorithm to not show that to me ever again. So my Facebook feed is really clean. I only see things that I want to see. Similarly, I have liked certain things that I like to see. Like there are, you know, The Economist magazine, for instance, is one that I follow very regularly. I have liked it. I read it regularly. I share it, etc. So the fact that Facebook shows me stuff from The Economist is legitimate. I want to see it. That's good. And there are examples like that. So my feed is very well architected, and
Correct.
I am getting value out of Facebook. But if you just kind of listen to what's happening out there, when I was in Europe, a lot of people are like, oh, we hate Facebook in Europe. The connotation of Facebook is really bad. And then, you know, I also keep in touch with my sisters. I'm married to a European, so my sisters-in-laws are in Europe. We have close friends in Europe, and we keep in touch through Facebook. I'm like, yeah, I understand what you're saying, but there are people in my life who are far away, who live far away. The only reason I'm so close in touch with them is because I'm able to communicate with them and share my life experiences with them and see their life experiences through Facebook. So
Correct.
this is one use case of Facebook. There are other use cases of Facebook, like publicizing QAnon is one of those use cases. So what my feedback to you is that you will need to figure out what is the use case around which you're going to build your social network. Generic social network, the era of generic social network is over. So in that sense, I like what Jasmine is trying to do is create a very context-specific social network with very specific ideas, very specific intent, very specific community. I want you to also go look up my writings on Web 3.0. There's a formula that I created in 2007. Web 3.2 equals 4C plus P plus VS. There's a series of articles. You can go to the blog and see under hot topics. I think we provide that as still today. Social media has not taken into account what I've written about there is this context-specific use cases. You can build something very sticky if you are very specific content-wise, context-wise, very specific intent-wise, very specific use case-wise. If you try to be generic and you try to be everything for everyone, you're not going to succeed. Facebook is losing following. Facebook's numbers actually have started declining. Why? Because Facebook has tried to do everything for everybody. And I think that trend of decline is going to continue. But people today, Facebook started in 2004. I think MySpace was the first one that started even before. Around there, around like 2002, 2003, 2004, all these social media networks started. In 2007, the iPhone came into being. The really powerful smartphone revolution started in 2007. So today we are sitting in 2023, and
Right.
And the amount of momentum that has been created around the behavior of social media is huge. So the whole world, billions of people have learned the value of social media. But people have different use cases. People are using different things for different reasons. But you have to, as a result, you can't be everything to everyone. You have to pick a target audience and create a set of use cases that are going to be specific to that target audience. And I'm speaking to you, Kuldeep. I'm speaking also to you, Jasmine, in being very specific use case wise. You come into this media, social media, what is the killer use case that you're going to start using this platform for and fall in love with it? Absolutely fall in love with it, because that particular use case is very, very well thought through.
Right. So we can also, if you see my slides, we also talk about a platform for travelers. So basically, this could be a platform dedicated for travelers. If you see my initial slide, which says travel solutions on land, water, and air. So these are the three main modes of transport. So we can also
travel and transport are two completely different things.
Right.
Travel is something different. Transport is something different. Within there are lots of subcategories. There are solo travelers have a particular type of need. Couples have a particular type of need. Business travelers have a particular type of needs. Travelers with families have a different need. What, if you're talking about travel, what travel are we talking about? What, if you're talking about transport, commuters have a different need within, train commuters have a different need, car commuters have a different need. So what is the killer app? Tell me what is the killer app? And that's, you have to, I don't think you have an answer. I'm not asking for an answer right now. I want you to think about it and really work through the details of how you're going to build this platform. I think, if you look at the next 10 years, I do think the kinds of solutions, it's interesting that two social media platform projects came up in this session, right? It's not like we designed this session specifically to deal with new social media ideas, but it's kind of top of my mind also at the moment, just because of this discussion that I'm leading on Facebook about the future of Facebook and the future of social media in general. So it's that means that you are thinking about it, Jasmine is thinking about it, I'm thinking about it, I'm sure many other people are thinking about it. So there is momentum behind new ways of thinking about social media and so forth. So I encourage you to develop your ideas, but please try to be really specific
Sure.
so that everybody who uses it completely falls in love with it, and you have designed it. It's by design being used in a certain way. Not meaning what happened with Facebook was people got on it and then people started figuring out how to use it. Facebook didn't drive the killer app. Facebook saw this was happening. It was an accident, right? The
Right.
virality of Facebook was an accident. The virality of LinkedIn was not an accident. Reid Hoffman was a mature entrepreneur who had a vision for how he wanted LinkedIn to develop. Facebook, Mark Zuckerberg was a naive young undergraduate at Harvard who accidentally chanced upon this idea that went viral. It was not thought through. But going forward, we are sitting in 2023. Going forward, these accidents are not going to happen. You're going to have to think through exactly what is the use case around which you're building your social media platform, and accordingly deliver your solution. So everything has to be by design, no more accidents.
Absolutely. Yes.
So, I'm quite passionate about what you guys are doing, because I'm also thinking about what is the future of social media and what are the different nuances that have to be covered. So, so happy to work with you. I will explain in a moment. And all these things, questions that you're raising about what should be free, what should be paid, what is the business model, what is the go-to-market strategy, all of that will be derived out of the use case around which you're going to build your MVP and the rest of the vision of this project. So that's my comment on your business. I don't think there's any point going through all the details of your presentation, just because I think the fundamental question still remains open to be answered.
Okay. Sure.
Let me explain to you how to use 1Mby1M, and then I'm happy to take more questions. We have time for more questions. So you can ask me specific questions as we go along. By the way, folks, if you like what we're doing here, as you can see, I'm very candid with the feedback I'm giving you. I'm really trying to be constructive so that you can do something with my feedback, so that my feedback is actionable. I'm not trying to say, oh, great, you're doing great, blah, 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 next. I'm not doing that. I'm taking the time to give you a full analysis of what you're doing, why it will work, what will not work. And that's
Correct.
how businesses are built. So if you like it, let people know about coming here and seeking that feedback and engaging with that feedback. So resources-wise, you have everything at 1Mby1M.com. That is the starting point of using this platform for your own learning. The Entrepreneur Journeys book series and the blog series are available. The blog is free. The book series is very reasonably priced. Everything is available on Amazon Digital. These roundtables happen every week or every other week. You will have enough roundtables to come and talk to me once, though. The free roundtables, you can talk to me once. After you've presented once and dialogued once at a free roundtable, you're going to need to join the premium program, which is where I do the extensive mentoring and coaching and teaching in. In there, in the premium program, you will find extensive methodology guidance, really deep guidance on how to put one foot before the other. The curriculum is very rich, many, many thousand hours worth of curriculum. You will have roundtables like this for members only to come and dialogue with me every week. The private roundtables happen every week, sometimes multiple times a week. As relevant, we provide you help with business development, make connections, etc. We do help with financing, but with one caveat: you have to be financeable for us to introduce you to our financing network. We work with thousands of investors at this point. We have a really rich, really great investor network. We are very credible. People really trust us and all of that. As a result, we don't send anybody and everybody to these investors. We have to prepare them before they can go talk to investors. So that's the premium program. The self-assessment is something that is available for free on the website. I recommend that you take a look at it. These are the due diligence questions that VCs are going to ask you. So you have to be able to answer these questions. And I encourage you to start with keeping that in mind as you're developing your business, because this is how strategic planning happens. Good, solid strategic planning happens when you answer these questions. There's a free bootstrapping course on the website. You can access it through the blog. It's less than 1 hour and it's really good. Hundreds of thousands of people have done this course, so I strongly recommend that you at least spend an hour going through it. Also, we have, in the last couple of years, we have released more than 30 courses on Udemy, and they're very, very reasonably priced. So, and Udemy offers deep discounts. We offer discounts to these courses. Every month we publish discount coupons on the blog. So if you just go to the blog and look for Udemy coupons, you will find coupons for the month that are valid at that point. So Udemy courses are another way of learning the methodology. Our entire curriculum is also accessible on a subscription basis on the 1M1M site as 1M1M Basic. This is a curriculum only option. You're welcome to use that for your learning as well. So go to the website, see what makes sense, what you want, how you want to learn, how you want to use the resources, and then decide, how you want to move forward. There are FAQs, video FAQs, description of the curriculum. It's a case study based program. We use case studies extensively to teach this program. One of the reasons why I am as knowledgeable as I am about the startup field is because of these enormous number of case studies that I have done individually with entrepreneurs all around the world. And I've learned from them, and I'm able to teach you because I have learned from them. Our investor introduction policy is clearly laid out on the website. Please take a look at that if you're coming here in search of funding. Our philosophy is bootstrap first, raise money later, because concepts don't get funded in the industry. So it's just not possible for us to take you at a concept stage to an investor and get you funded. It's not going to happen. So we emphasize bootstrapping hugely so that you can be fundable. And we need to have that bootstrapping strategy in place for you to be able to be successful in fundraising. So that is it. We have a lot of roundtables coming up. There are 4 in February, most likely. Are we doing 4 in February, Maureen? I don't know. We'll have to play it by ear a bit. You can dial in at this point. You can dial in and ask questions. Irina is your contact. If you're looking to ask questions about the 1M1M program, you should contact Irina. And Irina is very knowledgeable about the program. She will be able to answer most of your questions.
Perfect.
Did somebody put something in the public chat? Robert, hang on. You're sending me private messages. If you could not send me private messages, that would be great. Let me see. Robert is saying, thanks for letting me join today. I will review the website, your link to my app. Okay, great. All right. Anybody else? Any other questions, comments? We can take questions, and I can put back the slide for the dialing in instructions. If anybody has any questions, you're very welcome to call or even ask questions in the public chat. Put your questions as public questions so that everybody can see. Anybody else? Yes, no?
No.
All right. Very good. Well, good luck, everybody, and I will see you in the next roundtable. Or before, if you're in the program, if you join the program. Bye-bye. Talk to you soon.
Thank you so much. Thank you.
Thank you.